Health Diary, thank you for joining us. My name is Gladys Gachanja and we're coming to you from the Grammar Suits here in Nairobi. It is estimated that 1 in 10 people will develop kidney stones sometime in their lifespan, with men more affected than women. Now, with this condition being seen in more people today, we shed light on exactly what it is and what causes it, starting with this fact of the matter. Kidney stones are hard deposits made of minerals and salts that form inside your kidneys. Though there are different causes, kidney stones often form when the urine becomes concentrated, allowing minerals to crystallize and stick together. A kidney stone may not cause symptoms until it moves around within your kidney or passes into your ureter. Treatment for kidney stones varies depending on the type of stone and the cause. Prevention of kidney stones may include a combination of lifestyle changes and medications.
I got kidney stones when I finished Form 4, after I finished high school. So I just started getting sick. I don't know, I'm eating something and then I just feel like I want to throw up. I don't know why. I realized that the vomit was green. First, the doctors didn't know exactly what it was. Yes, so they tested and then they got, now I have the kidney stones. I got operated during that time, so they had to remove. Now from there on, I was told now, whether you like it or not, you have to take water so that it's not like, it doesn't cause any harm. But it was painful. I remember I couldn't sit, I couldn't stand, I couldn't sleep. I was like crawling on the tiles because the pain was so much. So I had to be, actually they rushed me to hospital first because of the pain. Worst part of it was, now you have to be not very keen on what you take. Nothing, and I used to love taking udongo. You know udongo, what is it called? Stones, yes. I used to love that, taking them. So now I had to cut that out. I had to especially insist now on taking like fruits, things that are light and everything. Yeah, still today, I still have a problem of taking water. My worry was, would it affect my, future in terms of giving birth, my ovarian system, everything down there. And because of lack of information, you have those fears. So that was one of my fears. And then after now, I read about it. Now I got informed about it. It's like, no, it actually happens. It's commonly. And also my dad also had his removed. Then I didn't have a medical cover, and I remember it took a toll on my dad, who was just a farmer at that time. Then we were like 4 people who needed to be paid for school fees. And then there's this that came abruptly. Then now my brother-in-law now had to pay my bill, and everything was abrupt. I remember I was even kept in the hospital for an extra day till like we raised the money. So, and then right now going forward, you need to work, and my job is not the white-collar job where at least you sit in an office. Mine requires a lot of going out there, a lot of hustling, a lot of standing. So in as much as you want the money, you can just do as much. You cannot do more.
Okay, so what are kidney stones? Let's understand this, and to help us do so, we have Dr. Samson Misango, who is a general surgeon and urologist, and we have Byron Otieno Oyugi, who is a kidney stones patient. Gentlemen, thank you for joining me. So let's start off. Kidney stones are hard deposits made of minerals and salts that are formed in your kidney. What causes the stones?
The kidneys are organs in the body that have the role of getting rid of chemicals that are unwanted in the body. So these are chemicals that you will either be producing or you are getting from your diet in the body. And since they cannot remain in the body forever, the blood goes to the kidney, and the kidney has a special mechanism of filtering and excreting them outside. So occasionally these chemicals, they become concentrated too much. Some of these chemicals, when you are not very well hydrated, they begin sedimenting in the channels of the kidneys. And at some point, they will come out. a lot of times the small stones, okay, these are now what we call kidney stones. These supersaturated solutes within the urine. Kidney stones are just deposits of chemicals in your blood that find themselves into the urine.
What causes or what about your body would actually lead to the concentration of urine?
The more water you take in, the more water you're going to bring out. Okay? So if you do not take enough water, then what comes out in the urine will be concentrated. And I think everybody is aware of how it happens. If at all you've not taken enough water, your urine gets very yellow. Okay? Yeah. And if you take a lot of water, the urine gets quite light, just like water. The other thing that might make them get concentrated is if at all your body is producing a lot of these chemicals. And there are people who have diseases in their body that makes them remove calcium from bone, because calcium is there in bones, in muscles, and other tissues. So there's some particular disorders that make you produce a lot of these chemicals. Number 3, you could be absorbing a lot of calcium from your diet. There are people who have that disorder. So you're taking calcium and you're absorbing more than you should. Number 4, you could be having a disease within the kidney that makes calcium and other chemicals leak out. Okay, so there is an interplay of so many things, but ultimately it leads to excessive concentration of these chemicals.
Okay.
Yes.
All right, so Byron, you're a kidney stone patient, and we call you a patient because your treatment is ongoing. What were your symptoms? What made you know there was something wrong?
I had very severe and sharp pains on my stomach and at the back here. So the pain weren't just normal, because as much as I have a sensitive stomach and stuff, I just had the severe pains it went for like almost 2 months before I discovered
That you had kidney stones?
Yes.
Okay, so Dr. Harris, what is unique to kidney stones?
I usually, sometimes when I talk to my students, I use this phrase, and it's not a curse word. You have bloody pain, okay? It's a bloody, painful condition. Because the thing which will strike you very much about a kidney stone pain is it strikes without warning. It's like a switch has been just turned on, and the pain hits you, just like that. And people have said this might be the most painful condition you can ever experience. We compare it with labor for women, but women who have gone through labor say that pain is even worse of the kidney stones, because it's a pain that comes very sharp and abruptly without warning. And together with this, there might be some nausea and vomiting. Okay?
Now, Byron, I know before you got diagnosed for kidney stones, you had a lot of misdiagnosis, right? Yeah, sure. What were you told you were suffering from?
I was told I had ulcers, so I used to take like drugs for ulcers before. But since the pain was coming and going, sometimes I thought that maybe it was ulcers, since sometimes I used to take the painkillers and I feel better, and at some point the pain comes back. So it hits very hard, and it was just not normal. It's painful for it.
Yes, and let me tell you why it will be very confusing to a lot of people is because, you see, after the initial pain that comes without warning, the person kind of gets used to that condition, okay? Because this is a pain that comes when the stone is moving. You imagine it's a small stone moving in a very small cavity called the ureter. So as it passes down, it gets stuck. So that's the pain that hits somebody very hard. However, urine is still being produced, so the stone is being pushed down. When it's moving, there's pain. When it's stationary, the pain goes away. So during that time is when there's going to be a lot of misdiagnosis. Okay?
Is it possible to have kidney stones and not have any symptoms?
Yes.
And is there a danger with that?
No. Not at all. Because the body, the way the body is wired is it warns you when there are complications occurring. Many people will get stones and they will pass without any incident. So very small stones we say less than even maybe 1 millimeter, you will not even notice. They come out in your urine. Yes. And there are people who are so much used to getting stones that they get that pain and they know, oh, that's my stone coming out. Okay, because they have lived with these stones, especially people in northeastern and India, other areas, where the stones are very common because of the weather and the diet of the people.
So Byron, is there anyone else in your family that has ever had to deal with kidney stones?
There's no one that has ever. I was the first case in the family. So far, I haven't had any other case in the family.
Now, if you have a family member who has had stone, then you are likely to get affected with a stone yourself. Okay? If you had a stone in the past, you are likely to get another stone in your lifetime. Okay? If you are living in an area which is endemic for stones, okay, you are likely to get a stone more than somebody else in a different area.
And when you say endemic,
Yes.
an area, what does that mean?
Like we have communities in Kenya, I can tell you in northeastern, right? Because of the weather patterns around there, okay, we have more people with stones among the population.
Because it's hot.
Because it's hot. We have people who are obese, okay, overweight. We call them people who are excessively overweight. They are more predisposed to getting stones. We also say stones are sexually biased. Then we also have particular conditions. People who take a lot of red meat, right? They will be more exposed to getting stones because we have other stones which are called Purine stones. There are people whose genes predispose them to getting stones. Okay, so it's there in the gene. And this is more common in some European population. Okay, they have a metabolic condition that makes them get stones.
So Byron, we know not taking enough water predisposes you. Dr. has talked about some diets, a lot of meats, you know. When you look back, have you been guilty of any of these?
Yeah, I'm guilty of not taking water and meat, a lot of red meat.
And have you changed that since?
I have changed.
And has it made a difference?
There's a difference because I don't feel the pain anymore, and I wouldn't even want to go back to where I was. It was painful.
Why men more than women?
Men have got more metabolic processes happening in their body than women. He produces more chemicals than the woman. Okay? So, inherently, their chances of getting, okay, we normally have about 3 to 5 men per 1 female who might get a stone. The other thing which makes the women a bit more, less subjected to kidney stones is their hormones. Okay? The female hormones are protective in so many ways until they get into menopause. Then they begin equalizing with the men.
I think this is the first time I'm hearing that hormones are actually a good thing and they actually take care of us as women. When we come back, Dr. I'd like to understand, you said some people can pass the small stones without even knowing they have them, but how about those ones who have the bigger ones? When we come back, we talk about the treatment and management of kidney stones. Stay with us. Welcome back. Our conversation today, kidney stones, still with me, Dr. Misango and Byron. And Byron, you said it took a while before they could figure out you were living with kidney stones. What was the diagnosis that was done to actually now say this is what you're struggling with?
My stomach was really hurting, so I used to just sit in the toilet like this. So I couldn't even notice I had blood stains in the urine. So that's when the doctor said that the problem could be my kidney. So I slept in the hospital. The next day I went for the scan, and that's when I was told that I had like kidney stones.
Are there specific tests that can be carried out to actually ascertain this is what you're dealing with?
The simplest test is what Byron has just mentioned. There's pain and blood in urine. Now, this blood in urine might be blood that you can see with your naked eye, or it might require microscope. We look at it in the theater, in the laboratories. Since I said most of the stones will be composed of calcium, calcium is a chemical that shows on an X-ray. Bone shows on X-rays because of good calcium deposits. Now, these days we have a bit more specialized scans. We call them CT scans, okay? That, I'm sure that's what Byron was subjected to, that is able to visualize that stone because it's composed of calcium and gives us an indication where it is in there. Is it in the kidneys? Is it in the ureter? Is it in the bladder?
You've already undergone surgery and are awaiting another surgery. What else have you had to do or undergo to manage the condition?
I'm actually focusing more on my diet and drinking a lot of water. And I usually call him, and whenever I feel anything suspicious in my body. So far, there's nothing much I can do because of the not being able to like pay for the next surgery and everything.
Mm-hmm. So you're not on any medication?
I'm on medication. Mm-hmm. Yeah.
Okay. What other treatment options are there?
Number one, we want to make sure that the person is well hydrated and is free of pain, because that is what will take you to hospital. Number two, we want to give you medication that will improve the possibility of dissolving the stone and also increase the possibility of passing it outside. So there are medications which are available for this, and they relax the tubes so the stone can pass out. When this has failed, or when the stone is now causing other complications, then we have to get it out through surgery means. If left untreated, there can be infection that is going to envelop the whole body, or the kidney gets damaged in the process, because the kidneys are supposed to be continuously producing urine and flowing out.
What are the things that you've had to eliminate from your diet to help you along, apart from the meat that you mentioned earlier?
I used to take a lot of chocolates by there and spinach, because since I was told I had ulcers, there are some things I couldn't take by then.
Junk food also predisposes to stone formation because of the burden that it gives the kidney. Okay. Vegetables are good for your immune system, but there's some vegetables which are very rich in some chemicals like oxalates. What he's talking about, spinach. Okay. Because the calcium does not exist on its own. It has to bind with another compound for it not to be stable. Mm-hmm. And oxalates are the most popular formations of calcium for stones. Now, if you have conditions like gout, there are people who have gout, then they are predisposed to form what you call uric acid crystals. Now, these ones will deposit in the tissues, and you've heard of people who have gout. And the body will also want to excrete them in urine. So they have different types of stones called uric acid stones. Mm-hmm. Now, these ones can be dissolved by something in your diet. So, and that's why we advocate for what you call alkaline water, right? If you're able to alkalinize your urine, then you dissolve some of the small stones, not calcium stones, but the other stones that can be forming.
Let's talk about the costs of treatment. You just said you haven't gone ahead to do your second surgery because it is too expensive. Are you saying that you do not have support from NHIF, possibly insurance?
I didn't have an insurance. I tried NHIF, but the first time they only said they could pay for my bed. So for the other extra cost, because my first surgery costed around 680,000. The good thing is that I found a good doctor. He told me, relax, you'll just pay me later, let me talk to the hospital. So that was one of the advantages I had.
What happens? Are there many people out there clearly living with these kidney stones and have no intervention because of the cost?
If we had a chance of doing some of these cases in a public hospital, of course it would ease the burden. But we are having challenges with equipment in the public hospitals. I work in a public hospital, I know the burden. I work also in the private sector, so I get to see And I see insurance companies, they pay for some cases they don't pay. And even when they pay, the amount of money they commit for operation is different. Laser therapy in Kenya is fairly expensive. It will range from the simplest operation, maybe about 300,000 to as much as 1 million in one kidney.
Even as we close this conversation, Byron, you're walking this, path of kidney disease in your own way. What would you appeal to the health infrastructure to actually provide for those who are dealing with this condition?
Anyone involved in the health ministry or anything that has to do with the health, that they provide the doctors with all the necessary needs, even in public hospital, because if I would have gone to the public hospital, maybe I wouldn't have been here, because there are a lot of people that are suffering. And he even told me before the surgery that there are only 36 urologists in Kenya.
36 urologists to a population of over 47 million?
Once upon a time, there were no urologists in Kenya. They had to come from outside. Then you got our first one, and second one, all foreign trained. In the last 5 years, we now have a training facility in Kenya, at Kenyatta, that trains urologists. And I think last year we produced our first urologist from that, the kidney. It's actually an institute, the Kidney Institute at Kenyatta. So we are training urologists. But the population of Kenyans is also increasing. So we will never say that we have enough, I don't think. But we will have to do with what it is that we have. So we have the private sector, we have the public sector, and we work together. Okay? My only hope is that as time goes by, we will be able to have a down-up approach, where the professionals who are there in the public are able to drive the process of equipment acquiring. So that, because we know what it is we need for our cases, all right? As opposed to a situation where you have things being brought, there are no personnel. We have annual camps as Kenya Association of Urologists, CAUS, okay? Where we have a team of about 20 urologists. We go and we hold a medical camp and we deal with all the urological burden that is available. On top of that, we have an intrinsic system of referral and consultation. We talk among ourselves. There might be a colleague of mine who has handled a different type of stone that I have not handled. So I will refer to him, a patient, and he will refer to me, a patient who he thinks I can handle in a better way. So we cannot say that it's so bad. There's still a lot of work to be done. We are working with what it is that we have available.
Okay. Dr. Samson Misango, General Surgeon and Urologist, and of course Byron Otieno-Oyugi, who is a kidney stones patient. Gentlemen, thank you for joining me on this conversation. And as you've heard, a lot needs to be done in as far as investing in our health infrastructure to help those living with this condition and other kidney diseases. And there is a step in the right direction, as Dr. is saying, when the public and the private sector work together. Time now for the health tip.
Generally, girls start to teeth earlier than boys, okay? And then, so it depends, so it can either start between 5 to 6 years or about 6 to 7 years. The first teeth to come out are actually these lower front ones, okay? So if you're having a male child, yes, the range is 5 to 6, but you're saying boys' teeth a bit later than girls. So maybe your firstborn was a girl and then your secondborn is a boy, and then you start worrying. So just remember, like, boys take longer. Also, if it can be also be genetic in the case of, like, some people take longer. So the normal age group is 5 to 6. If your child starts teething at 7 and you started teething at 7 yourself, then it's okay.
It has been yet another informative episode of Health Diary. Remember, you can reach us with your suggestions and comments on our social media handles. Until next time, my name is Gladys Gachanja, and yes, we'll be coming to you from the Grammar Suits here in Nairobi. See you. Health Dairy, thank you for joining us, and we're coming to you. Hiya, my name, from the Grammar Suits here in Nairobi. They say 1 in 10 people will develop sasa ni kizungu gani hiyo naimba with the rate of kidney stones